Hi everyone, so this is the first video of the option series and we'll be looking at pharmaceutical products and drug design. So medicine and drugs, these are chemical substances. They can alter incoming sensory sensations. These kind of drugs will enhance or interfere with the activity of receptors in the brain. You can have drugs that also affect a person's mood or emotions. And you can also have drugs that cause change in coordination. For example, you can have loss of coordination, loss of muscle strength, loss of consciousness, numbness, seizures, paralysis. So these are all effects of drugs. Now, definition of a drug, it's a substance that causes psychological change in the body. In simple terms, a drug changes the way the body functions. Now, medicines or pharmaceutical drugs, these are used for the treatment or prevention of disease. So we can say that medicines are beneficial drugs. And the beneficial effect of a medicine is called its therapeutic effect. And examples of medicines include aspirin, penicillin, ibuprofen. So these are medicines or pharmaceutical drugs. And then you have recreational drugs, which are substances taken for enjoyment purposes. And they are usually associated with more a negative connotation. So, example, alcohol, nicotine, cannabis, ecstasy. In this topic, we'll be looking at the terms medicine and drugs interchangeably. So they will mean the same thing in this topic. Now, how do we take drugs? There are different ways for drug administration. We can have oral drugs. These are taken by the mouth, tablets, capsule, pills. These are easiest for the consumer to take. However, it requires that the medicine is absorbed by the digestive tract, and some medicine may irritate the digestive tract or cannot be absorbed by this method, and therefore we have to look for another route for absorption. Second one is by inhalation. So the drug is breathed in by smoking the vapor, and this is very useful for asthma medication. And this includes example like the use of inhalers or nebulizer. So the medicine is going to be breathed in. You have skin patches. These medication are absorbed through the skin into the blood. So for example, you have hormone patches, or sometimes you have pain relief patches that are available on the market. So you just stick the patch where you have pain, neck pain, knee pain. So wherever you have the pain, you just stick the patch and it's going to relieve you from the pain. You have suppositories, and these are inserted in the rectum. And examples are taking laxative for constipation. Some pain killers are also inserted as suppositories if they need to have fast action, and if it's going to irritate the stomach. We have ear or eye drops. This is when liquids are administered to the eyes or the ears, and this is usually used for the treatment of ear, nose, or throat infections. And then you have injection. So there are three types of injections that can be done. You have intramuscular injections, where the drug is directly injected into the muscle here. You have subcutaneous injection, where the drug is injected under the skin. This is in the skin tissue here. And then you have intravenous. Intravenous, the drug is directly injected into the bloodstream, and this is the most rapid effect, as the drug is quickly distributed to the body with the blood flow. So intramuscular Injections, these include antibiotics, vaccines. If you have the EpiPen or adrenaline injections for severe allergic reactions, and EpiPen or intramuscular injections. Subcutaneous injections, these include insulin, allergy medication. You also have fertility injections. These are subcutaneous. And intravenous injections, this is what you're going to get when you have those IV fluids in the clinic. And inside those IV sacs, they're going to have drugs, chemotherapy drugs. You could have painkillers, you can have antibiotics, anything that you want to be delivered into the bloodstream to act very quickly in the body is going to be administered through IV injections.